It was in the evening of this Friday, 6th October 2017, when the School of Medicine and Pharmacy of the University of Rwanda, in collaboration with Urunana Development Communication, carried out the study with support from SPIDER, a research organization based in Sweden, were screening the use of telehealth for cervical cancer and care in Rwanda research findings. This case study was chosen due to the fact that cervical cancer is one of the biggest diseases that needs IT solution to solve such illness problem, mostly exposed to feminine gel. The exposures dealt with showing the importance of telehealth in the life of citizens of Thousand Hills. Through this expose, the researchers got some feedback from the audience. Before doing this qualitative research, their aim was to showcase what is doable and undoable in health field using a sophisticated ICT tools. Seeming to agree to what the government of Rwanda is doing to reinforce the use of ICT in all domains, here doctors and health issues specialists revealed that the use of ICT in medicine sector is still lagging behind. Dr. Stephen Rulisa is the principal investigator in this research.
Well, what we wanted to mean is that Rwanda is one of the countries with IT infrastructure everywhere. In all, at least all health facilities have IT, and so we wanted to make use of it in health also. We know other facilities are tapping in the use of IT, so we wanted to ask healthcare workers to make use of the IT infrastructure that is close to them and save lives and make life much easier for the patient traveling long distances when it could be solved in their home areas.
Supporting this, Mr. Joseph Ngenzi is the IT practitioner. He actually works for the University of Rwanda in the Health Informatics Department. He's especially a researcher in telehealth application countrywide. He's also the one exposed such findings. For him, telemedicine guidelines in Rwanda are not yet in place. The message is addressed to Trinity government institutions.
One of the areas we have found within the research findings was the policies. The policies, especially telemedicine guidelines, are not yet in place. The reimbursement model, the adoptions by the specialty to offer services to remote hospitals. So there needs to be clear guidelines, telehealth guidelines, but also there is a need to implement some pilot project to see how it will work and how it could be rolled out in the whole country, not only for cervical cancer, but also for other health services.
However, nowadays, telehealth started being used in Butaro Cancer Specialized Hospital 5 years ago. Here you hear from its Director General, Dr. Talsis Mhunga, explaining the challenges they are facing now and what other hospitals could be facing once they started using telehealth system.
What I'm talking here is just to bring attention for some challenges people are facing when they're using the telemedicine. One of them is now that you have to have an infrastructure in place, which when you're talking about telemedicine, people understand computers, internet connection, but there's some other issues behind which is not fixed. Let's take an example. If you are in medicine, when you take processing samples, for example, you have to be sure that the technician who is doing that is qualified. And they have a quality control system in place because of the quality of images guided and is now the key standard for having the good results. So you can have images, you have many photographers in the countrywide, but the image, the quality of images is critical in that diagnosis because of what distance level we're not directly talking with the patient. My wish is that people, because we know even if the internet connection network in countries is covered, but there's some remote area where there's not, the internet is not really still an issue. Even the cost is very high. So now I probably think some hospitals who are interested to be part of the study may face this problem of cost of affordability of this process.
In the room, Rwanda Utilities Regulatory Authority was represented when screening these research findings. Such anxiety in internet operation from the side of the government, especially in hospitals in need of connectivity, was given a solution.
Kubijyanye na network no kumakinga sure yuko ese imiyoboro inyuramo izo network irahari kuma center yose ya health. Rero ni inshingano zacu koko kandi dufite sinzi uko nabyita dufite gukorana hafi na telecoms kuko turegulatinga telecoms bose aho network itagera hari ubwo wenda dufite QoS service, ni ukuvuga dufite unit ishinzwe kugenda monitoringa nimba ahantu hose hagera internet ihagije. Ariko still hari ikintu abantu batazi wenda, nuko ufite uburenganzira bwo kuvuga ngo giyewe ku bitaro runaka uno munsi network yacitse, mugahamagara muri customer care yacu. Dufite department ishinzwe kurenganura. Ni ukuvuga ngo hari ubwo network ibura icyumweru kigashira wenda nko kwa muganga yabuze, ariko twe ntidushaka kubimenya. Mu burenganzira bwanyu, nimba uno munsi ugiye kuvura umuntu ukabona network uri gukoresha iracitse, ako kanya uhamagaye ugahamagara kuri rura, ntabwo umu operator twamuha warning 1 2 3 ngo azabikomeze. Rero ngira ngo no mu muco wacu tugomba kumenya guharanira uburenganzira bwacu. So igihe cyose batatanze service mu masezerano twakoranye barabihanirwa.
Sylvie Muteteri works for Urunana Development Communication that participated in this research thanks to support from Swedish Program for ICT in Developing Regions, SPIDER, for her whatever challenges exposed by experts from screening first phase of It's Among Four Left. She on her side highlights the use of Urunana Theatre to disseminate key messages through Urunana Development Communication's social behavior change communication program to sensitize the population about cervical cancer.
When SPIDER came in for this research, they connected with Urunana as one of the best SBCC, a social behavior change communication organization, and then learned from our experience on what we have done so far with telehealth, what we have so far portrayed concerning the cervical cancer. And this is when they came and collaborated with us. We became a part of the research, not only doing part of the management. This was the first phase. It was like identifying whether this is feasible. Now, the second phase will be the implementation, and it aims at starting small. And then the success would be replicated.
Scientists in their summary book mentioned cervical cancer as the second-range cancer killing many people after breast cancer, and it is quite considered as a challenge or a burden to the society of Rwanda. Cervical cancer is the most common cancer among women of productive ages, just between 15 to 45 years old, and that the previous studies showed that Rwanda has some of the highest cervical cancer incidence rates in the East African region.